Clinic 301. My name is Sharif, a medical intern. The internship period is the worst phase in any doctor's life. It means 36-hour shifts, fragmented sleep on broken chairs, and a salary that barely covers the coffee you need to stay awake through this nightmare. I was on a night shift in an old, dilapidated public hospital. One of those hospitals whose walls, if they could speak, would tell horror stories better than any movie. It was around 3 a.m., and the emergency room was unusually quiet, a rare and unsettling occurrence. I was sitting in the doctor's lounge, trying to doze off, when I heard a nurse's low voice calling me. "Dr. Sharif, there's a patient waiting for you in Clinic 301. I was very confused. First, there was no such thing as Clinic 301 on our floor. All outpatient clinics close at 2 p.m. Second, any emergency case goes directly to the ER, not to a closed clinic. I asked her, 301? You mean the ER? She gave me a blank look and said with the same calm tone, "No, doctor. The patient is waiting in 301. Then she disappeared down the dark corridor. I got up, telling myself I was probably just hallucinating from sleep deprivation. I walked down the long, empty corridor. The hospital has a different kind of dread at night. The sound of your own footsteps echoes, and the distant hum of medical equipment sounds like the breathing of a dying patient. At the very end of the corridor, I found a door I had never noticed before. An old wooden door with a small brass plate on it, on which was faintly engraved, 301. I hesitated for a moment. But I'm a doctor, and this is my job. I opened the door and went in. The room was small, containing a desk, 2 chairs, and an old examination bed. There was no modern equipment, and it had a strange smell, a mixture of old disinfectants and dust. On one of the chairs sat a man in his 60s. He was wearing simple clothes, his hands resting on his knees, staring at the floor. His face was extremely pale, and his features were worn out. I sat down at the desk and said, "Hello, sir. What seems to be the problem?" He lifted his head and looked at me. His gaze was strange, empty and sorrowful in a terrifying way. He said in a low, quiet voice, "I'm very tired, doctor." "Tired from what exactly? What are you feeling?" He said, "I feel cold. A very deep cold." This was the strangest symptom I had ever heard. It was hot outside, and the hospital was stuffy. I reached out to feel his forehead for a fever. The moment I touched him, I pulled my hand back as if I'd been electrocuted. His skin was cold. Not a normal cold, but the cold of a morgue refrigerator. A cold devoid of any trace of life. My heart started pounding. I tried to hide the tremor in my voice. "Okay, what is your name, sir?" He looked at me again with the same empty gaze and said, "My name is Saber. I've been here for a long time." The past tense he used, "I've been," made my blood run cold. I started connecting the dots. The non-existent clinic, the strange nurse, the unnatural coldness. I stood up and told him, "All right, Mr. Saber, just a moment. I'll go get you something from outside, and I'll be right back." I left the room, closed the door behind me, and ran as fast as I could to the doctor's lounge. I found Dr. Adele, the most senior doctor in the department, awake and drinking tea. I told him what had happened, panting. He looked at me for a long moment, then sighed and said, "Sharif, there is no Clinic 301. That room used to be the clinic of an old doctor. It was shut down more than 20 years ago after he died in it." I asked with a trembling voice, "Died in it? How?" He replied calmly. He had a patient named Saber, a terminal cancer case. One night, the man's condition worsened terribly and he was in great pain. The doctor couldn't do anything for him. Saber died while holding the doctor's hand, begging him to relieve the cold he was feeling. I swallowed hard and asked, "And the doctor?" The doctor had a nervous breakdown a few months later and quit medicine altogether. They say that before he left, he would see Saber every night. He would come at the same time, sit in the same chair, and make the same complaint, the cold. After that night, I requested a transfer from the hospital. I will never forget the touch of Mr. Saber's hand, nor his empty gaze. And sometimes when I'm sitting alone at night, I feel that same cold breeze, and I remember his voice saying, "I'm very tired, doctor."